Good morning and welcome to our seminar on ISO 45001. I'm Teresa Hawkins and I'm the Director of Assessment at NEBOSH. Like all good presentations, we're going to start with the welcome, covering our normal issues, housekeeping issues. So we don't have any fire alarm scheduled today, so if you hear a fire alarm, I will be making my way out of the door here pretty sharpish. Of course, in a controlled and orderly fashion. If you have to leave for any reason at all, you can listen in later to our NEBOSH catch-up service. You don't need an app, it will be in our alumni section of the website. But I will say, like all good catch-up services, like the little red button on the BBC catch-up, where it says your vote will not be counted, your questions will not be monitored. So please stay and put questions on now if you want to ask questions. You can ask questions at any time by typing in the Ask a Question box under your screen. Feel free to submit questions during the presentation, ready for the end of the presentation. I will endeavour to answer as many of your questions as possible, but with over 200 people attending, please forgive me if I don't get to all of the questions. And also use this facility if you have any problems. I think a few of our delegates have already used that when they've had a few questions. So I have a number of technical staff here in the room, so any technical issues they will deal with. And I also have some links later on at the end of the survey that we will put up at the end of the presentation for you on some useful information, and they'll be on the alumni part of the website too. So, and the other thing that we will be sending out is a survey from Barry Wilkes, our NEBOSH Director of Strategy, who will be asking you what you know about 45001, etc. But it won't be a test on what you've learnt today. So what we're going to cover today, I'm going to cover the story so far, how have we got to where we are. I'm going to discuss the potential timescales, and I'm saying potential because, as you'll see when we get to them, there are a number of timescales that might happen. The benefits to your organisation for when you're trying to sell a management system into them for health and safety. I'm going to do an overview of the standard, and then I'm going to do my thoughts on the significant subclauses. Well, actually, it's my thoughts on the bits I think are interesting. I'm going to do a little bit of an overview on the main differences and changes from OSAS 18001. As I said, I'll put up some useful information links, and then we'll have some questions. When it gets to the question time, my colleague Matt Powell-Howard is going to actually ask the question. So if your question doesn't get through, it's Matt's fault.
Thanks, Teresa.
You're welcome. So what's the story so far? We started back in, well, the actual physical process started back in March 13. That was when the ISO Health and Safety Management System, the decision was made that it was required. And that was actually from a vote of the ISO participating member countries. So that meant a sufficient number of the 46 ISO member countries participating in the vote voted to accept the UK's proposal to develop an occupational health and safety management system. In reality, obviously, it started before that, the preparation or the things that go on behind the scenes, the discussions with the ILO for an MOU, Memorandum of Understanding, that the ILO were happy for the ISO committee to start on this work. So the first physical meeting of the actual group preparing this standard started in October 13, and that was attended by 83 delegates from 27 member bodies and 5 liaison members, and some were participating by webinar. So the difference between a member body and a liaison member is that a member body is a country, so like the UK, the USA, Ireland. A liaison body is a body that doesn't have any voting rights but has a real interest in the standard and has been accepted as being able to contribute towards building the standard. Memberships like IOSH or like the ILO, the International Labour Organization, they can't vote, but actually they've taken part in developing the standard itself. So you might wonder, why have I been involved? So I've been involved because I was fortunate to be accepted as one of the UK delegates to attend the meetings, because I sit on the BSI group that talks about health and safety management system. So I applied, and I was agreed that I could be one of the members. So I form part of the project committee, which is PC283, and I've taken part as an expert in all of the working groups. I was head of delegation in Geneva, and I will be head of delegation again in Malaysia, which sounds really fantastic. Basically, it means I'm the one who can put my hand up for the UK to vote during the PC meetings, which is the project committee part of the meetings. So all delegates, whether they're liaison or member parties, take part in the working group meetings and in the development. So then we move on to March and April, end of March, beginning of April 14, where we started drafting CD1, which is the committee document, and that was in Casablanca. And then in January 15, a decision had been taken, voting by the working group, that we weren't happy with the content of the committee draft, and it wasn't ready to go out for the wider world, so we drafted a second committee draft of it. And then in June 15, that was approved to say, yes, we're happy with this draft, so we are happy that we can move on to turn it into a draft international standard. And we accepted comments from all the mirror groups, which are the groups like BSI that sit in all the different countries that are taking part. So June, July, we started drafting the international standard. September, we carried on drafting the international standard. And then we put that up for consultation, and in May 16, the ballot closed to say, are we going to approve this draft international standard? And it was not approved. So then we took comments from that series, and then in June 16 we started working on the second draft international standard, DIS2. September, a small group of about 20 people carried on doing some drafting and looking at some of the important issues, and took those back to a further meeting in November 16 in Lithuania to try and complete the drafting. And finally it was finished in February 17. The reason that's taken so long is because of the number of comments that come in. Every comment that is submitted needs to be looked at and considered, and a decision made whether or not we move on or not. So July 17 was actually the close of the ballot for the DIS2, and thankfully it was a successful vote. So then if we move on to what I think is going to happen next, so we have another meeting in September, which is where we're disposing of comments that were received from our DIS2, and we're making a decision on whether it has to move forward to an FDIS, which is a final draft international standard. If at that meeting the decisions are made that actually none of the comments that are accepted make any technical change to the document, then it can be accepted as it is, and then it could be published as early as the end of October. Personally, and this is personal view, I think that's very unlikely, because seeing the number of comments that have come in, it's very unlikely that none of those technical comments get through and we just end up looking at editorial comments. But it is a possibility. If there is an FDIS, the final draft standard, that'll add 5 or 6 months to the process, because it has to be written out, it has to be drafted, it has to be translated, and then it has to go out to vote. The vote on this will be a simple yes, no by all the countries that can take part, with a rationale of whether they, of why they're voting no. Previous votes have required not just a majority, but a minority of no votes, as well as a more than 2/3 of yes votes. It gets very complicated, the statistics, but that's how it works. In which case, if we do need to go to an FDIS, we will have to require an extension, because the process, the actual project, finishes at the end of October this year. And in theory, we can only ask for a 9-month extension. If we have an FDIS, the earliest it will be published will be the end of March 18. If it goes to the end of the extension, in theory, that would be June 18. But who knows? There may be, if there's a no vote, there may be, if it decides, or that the group decides we will publish it as a technical standard instead of an ISO standard, or there could be an unprecedented second version of a final draft international standard. As it says, it's supposed to be a final draft, so it would be unprecedented to have a second final draft. I'm not sure if there's a term for that. Or there could be an unprecedented extension further than June 18, which is a possibility in this case because it's such an important standard, and so many countries are actually interested in the standard itself. So we can move on. What are the benefits? So here, these are the standard benefits, really, of introducing an occupational health and safety management system in whichever guise it might be. So, reduction of work-related injuries and ill health, elimination or reduction of risk, demonstration of corporate responsibility, meeting clients' requirements, brand and staff motivation. So, personally, I think that's more of a benefit if you've got no health and safety in place at all. And given we're working in the UK and legislation sits there in most other countries that people are listening into here, there's legislation that sets out minimum requirements. I don't think it'll actually go as far as this, but it will go towards it. But what I would think it will do is it will demonstrate the organisation's commitment. It will help it meet its responsibilities in the supply management chain, help its brand, and motivate and engage staff in occupational health and safety, because that's one of the fundamentals of this new standard. So to move on to the next slide, and that's actually looking at the benefits of implementing ISO 45001 as opposed to any other management system. So the benefits are that it will align with the strategic direction of the organisation. One of the big benefits are that it will integrate with the other management systems such as ISO 14001 and 9001, and I'll tell you in a little while why that will be and how it will be. It does involve involvement of the leadership team, so this is a standard that if it's implemented, actually your top management will be involved in it because they will be driving it as much as everyone else, so that will be a significant benefit to health and safety. It does require the involvement of workers. So again, that will be a good driver, as I said earlier, really, for motivating and engaging staff in health and safety, and then into the whole culture of the organisation, which has benefits in other areas as well. And by implementing the standard, it genuinely should show an improvement in your health and safety performance. I don't know when 18,001 will be withdrawn. That's a decision for the ASAS group. It wasn't anticipated that it would be withdrawn on publication, plus a bit of transition time from when 45,001 is published. However, there are countries that have embedded ASAS 18,001 into their legislation, so this might be taken into consideration as well. So, looking at an overview of the standard. As I said, the real benefit is it follows the same format as 14,001 and 9,001, and the reason for that is because of the Annex SL, or the high-level structure. So ISO standards now all have set out, management systems have set out this high-level structure, which then each of the groups who are looking at the specifics, such as the environmental, quality, or in this case health and safety, then feed information into that structure and expand it and make it specific to what the actual standard is. A useful document, if you can get hold of it or wish to purchase it, and I'll give you some links later for how you can do that, is this too, because that does show the Annex SL text in blue and the added text in black. So if you look at that, you can see actually what is common to all management systems and what's actually been added for health and safety. And you could use that then if you didn't get earlier versions of ISO 14001 to look at actually what is standard 14001 and what's different in the health and safety standard as well. It follows the plan, do, check, act cycle that we're all becoming used to now. So in planning, you're identifying risks and opportunities, establishing occupational health and safety objectives and processes necessarily to deliver your results in accordance with the organisation's occupational health and safety policy. In do, you're implementing the processes as planned. In check, we're monitoring and measuring activities and processes, taking into regard the occupational health and safety policy and objectives and reporting the results. In act, as it says, it's obvious, we're taking actions to continually improve the occupational health and safety performance to achieve the intended outcomes. And a little bit later on, I've got a slide that actually shows where each of the clauses do fit into this. So here we go. Here's the standard. Here's the Annex SL text, the top level clauses. So scope sets out the intended outcome of the standard. Normative references. There are no normative references. I didn't know what this meant, so I had to find out. So normative references are references where you have to make reference to other standards or publications in order to understand the standard. So there are none. So you don't actually need to purchase any other standards to use this standard. So that's what that means. Terms and definitions. There's some specific definitions I've picked out because I think they're quite interesting. When you look for yourself, you might find others that you think are relevant to you. But these are ones that I specifically think have taken quite a lot of discussion during all the meetings, and probably terms and definitions are the area that's caused the most consternation amongst groups, and a lot of that is because of understanding in different countries. I'll talk through the context of the organisation, what that means and why it's different, leadership and worker participation, which is a big part of this standard, planning, support, operation, performance evaluation and improvement. I'm not going to go through Annex A. One, because it's informative and guidance on use and everyone has different needs. Two, it may well change when we come to the next iteration because it's one of the big changes from DIS 1 to DIS 2 is we did cut a lot of Annex A information out of it. So here we have the clauses fitted into the Plan, Do, Check, Act cycle. So it speaks for itself really. So plan covers clause 4, context, clause 5, leadership and worker participation, clause 6, planning, and clause 7, support. Do is clause 8, where you're looking at operations. Check, clause 9, which is performance evaluation, and act covers clause 10, improvement, which is all very straightforward, and I think it's quite clear, but I think it's quite useful to actually see it set out like that, and the whole Plan, Do, Check, Act cycle then makes lots of sense to everyone. So I hope that's useful to you. I'll now go on to some terms and definitions. Again, I say these are the ones that I think are interesting, useful, perhaps new, and maybe surprising to some people. The rule is on terms and definitions in an ISO standard that there should only be a definition. One, if the words is used in the document, and there have been terms and definitions in the document that we've subsequently taken out because we're only using them in one place, or we're only using them in passing, or it's only in the scope or something like that. So then they're not defined and they're taken out. Two, we've taken them out where we said actually you can look that up in the dictionary. And whereas you might say, well, I could look some of these up in the dictionary, you could look them up in the dictionary, but there's lots of different versions of it. And obviously one of the most controversial words in this has been worker. There's been a lot of discussion on actually what is a worker, who's a worker, what's a worker role, what's the worker's role in this standard. So some of the interesting things really under worker are the notes to entry. So it's a person who performs work or work-related activities under various arrangements, paid or unpaid, such as regularly or temporarily, intermittently or seasonally, casually or on part-time basis. So actually in the UK itself, and within NEBOSH qualifications, the term worker is what we would anticipate a worker means. It isn't a blue-collar worker. it isn't a non-managerial worker, it's everyone. So it's everyone who works in an organisation and takes part, which is why you will see in the standard there are references to non-managerial workers, where there was a desire to talk about what we would call blue-collar workers, or those people who don't normally get a chance to take part in consultation, participation and involvement in developing a standard, or what that standard means in the organisation. And there's lots of other notes as well. As I say, that workers does include top management, managerial and non-managerial persons, and that work or work-related activities performed under the control of the organisation may be performed by workers employed by the organisation or other persons, including workers from external providers, contractors, individuals and agency workers. Again, that's nothing that would not make sense to either anyone in the UK or anyone taking out NEBOSH qualifications. What is interesting to me, anyway, is the next bit where we look at participation and consultation. And you might think, why does participation and consultation need a definition? Everyone understands what participation and consultation means. Well, they do, but in some countries, the understanding of participation and consultation was swapped round. Our understanding in the UK is generally that participation is that you're actively involved in something, and consultation is when you're asked your opinion and you listen to and it feeds back. In some countries they're the other way around, so it did get quite confusing at times, and that explains some of the disagreements there was between the countries when we were discussing participation and consultation, when it became evident that actually the understanding of participation and consultation was the other way around. You will note there is no definition in here of worker representative, and that was because the thought was that actually that's well defined elsewhere, so it didn't need to be specifically defined in this document. And worker representative is only a subsection in this standard of worker. So very often it would talk about worker, or where they exist, the worker representatives, to give help to those countries that have collective agreements where worker representatives are in place, and those that don't have worker representatives, and so that it doesn't stop top management talking to all the workers if that's what they want to do. Again, there's a definition of workplace that you might think doesn't need defining. Well, it does in an international standard, because an understanding of workplace is one of the terms and definitions, I think, that got discussed in great depth at quite a number of meetings to decide actually what is the extent of a workplace. So eventually we've come up with a definition that a workplace is a place under the control of the organisation where a person needs to be or to go by reason of work. And that was very important in some countries, that they had a definition of how wide the workplace would be. But then there was a note, again because of concern in some countries, that the organisation's responsibility under the Occupational Health and Safety Management System for the workplace depends on the degree of control over the workplace. So again, it considers that people might be working in other employers' workplaces, and therefore control will be more in the realms of other employers rather than the direct employer. We then go on to legal requirements and other requirements and other obligations. In 14,001, the equivalent term is compliance obligations, and there was a lot of discussion on whether we should use compliance obligations. At the stage we were at, there was also a discussion on whether compliance obligation is the correct term, and we reverted back to actually what is the definition of compliance obligations, and included that in here. So it does mean the same, it's just set out, doesn't have that compliance obligations term that's used in 14,001. So legal requirements and other requirements. Legal requirements are quite obvious. They're statutory requirements that you've got to comply with. Other requirements that the organisation chooses to comply with could be this standard, for instance, is one of them, because the company chooses to comply with that, or it could be trade associations standards that you choose to comply with. So it sounds complicated, but actually it's quite simple, and it's so that an organisation can choose, other than legal requirements, which requirements it does want to comply with. So the next one I've chosen is injury and ill health. You might think, well, that's a strange one, that's quite straightforward, but it did actually require quite a lot of discussion to get to a definition of injury and or ill health, and it was only at the last minute we added and or ill health, because originally it was injury and ill health, which gave some problems in parts of the standards where we're using that phrase, because it comes as one phrase. So now you can have an injury or you can be ill, you don't need to be both. Hopefully, once setting in the standards, we won't have either, but you still need to consider them. So that is the adverse effect on the physical, mental or cognitive condition of a person. And then the note to entry says, these adverse effects include occupational disease, illness and death, so that we didn't have to discuss disease, illness and death in any of the parts where this definition comes up. The other ones that you might think are odd that I've added in are occupational health and safety risk. Now the reason that's in is because risk is already defined in the Annex SL text, but it isn't really suitable for health and safety. And because we can't remove Annex SL text because it applies to all standards unless it's changed in all standards, we couldn't change the definition of risk, and it really didn't fit in occupational health and safety. So there is a separate definition of occupational health and safety risk, which is the sort of definition that we all understand in the health and safety world. So it's a combination of the likelihood of occurrence of a work-related hazardous event or exposure and the severity of injury and or ill health that can be caused by the event or exposure. So that's a definition that we understand in the health and safety world, and it works quite well. So we don't tend to use risk in the standard. If we're talking about health and safety risk, we use occupational health and safety risk. If we're talking about risk, we're normally talking about risk to the occupational health and safety management system itself. The other one that's been brought in is occupational health and safety opportunity, again for the similar reasons that if we're talking about risks and opportunities, we then need to talk about occupational health and safety risks and opportunities. So there's a definition for that as well, in that the occupational health and safety opportunity is a circumstance or set of circumstances that can lead to improvement of the occupational health and safety performance as opposed to the system itself. So they are used in different areas. Definition of incident became very controversial because obviously some people wanted to use accident, some people want to use incident to include whether there's injury or not, or injury, and then there's all the discussions of near misses and that side of it. So it's quite a long definition. Well, actually the definition isn't very long. There's a lot of notes, but in a definition, as opposed to the rest of the standard, a note actually is part of that definition, if that makes sense. So, incident is an occurrence arising out of or in the course of work that could or does result in injury and or ill health. So then there's lots of notes to that. So note 1 to entry, an incident where injury and or ill health occurs is referred to by some as an accident. So we included that part in it that was concerning those people that wanted it to be an accident and not an incident. The other problem is with having accident that then it didn't work with when we get to clause 10. So we've gone for incident. Note 2 for entry is an incident where no injury and or ill health occurs but has the potential to do so. This may be referred to as a near miss, a near hit or a close call. Note 3 to entry, although there can be one or more non-conformities related to an incident can also occur whereas there is no non-conformity. That clause took quite a while to flesh out really as well, because obviously you can have an accident where it's where it's a weather or weather related incident that you may not have normally have covered. So that's looking at those terms and definitions. And so there are some more in there that are new to the standard from other standards, but they're the ones that I thought were most relevant. And actually they're the ones that I thought there was most discussion about and took us the most time to actually get to a consensus of. Because that's the other part of creating a standard. As you're working through the standards and deciding the clauses and agreeing on them, this is not generally by a vote, it's got to be a consensus. So a consensus of all those different people there from all those different countries takes quite a while to get to a consensus. So the person leading the group has quite a lot of work on their hands. So moving on to context of the organisation. So within 45001, greater emphasis is placed on the context of the organisation than there was in 18001. So organisations must identify all external and internal aspects which have a significant impact on its achievement of their occupational health and safety management system. So what the context is doing with, starting with, understanding the organisation in its context. What does the organisation do? How complex is it? So what is it that your organisation is all about? What does it do? What can affect its ability to manage its health and safety issues to achieve the desired outcomes? So what internal and external issues can affect it and its ability? So what's the size of it? What's the nature of the organisation? Is it a large multinational? Is it a small office? Is it a small organisation that produces hazardous products, etc.? All those affect actually the context and how complicated it needs to be. So external issues, what sort of external issues can affect it? New technologies, culture, social and political factors. So how do you determine this? It's up to each organisation to decide. The standard doesn't say how you have to do it. It can be informal in a small organisation, or it could be formal as your organisation gets larger or more complex. You probably need to use more definitive tools. So tools such as SWOT, looking at the strengths, weaknesses, opportunity and threats, or PESTLE, looking at your political, economical, social, technological, legal and environmental issues. You could use those. But it's really up to the organisation to decide actually, who am I, what are we, what do we do, what can affect us, what can affect our health and safety management system. It also includes, within the context, what are the needs and expectation of workers and other interested parties. Again, a worker is obviously an interested party, but they have a specific place within it. So, interested parties, as I said, there can be any worker at any level. Worker is anybody, so it could be anybody from your newest recruit to directors that have been there a long time. So there could be your customers, there could be legal and regulatory authorities. They're definitely an interested party, especially if something goes wrong. Your insurers are a significant interested party on what you're doing. The media may be an interested party depending on what you're doing or what's going on in the news at the time. So again, the organisation needs to determine who is relevant to the occupational health and safety management system. Who does it need to consider when it's considering the needs and expectation of interested parties? So it's very much set on the organisation itself who's deciding here what is important to the organisation and what will affect it. So determining the scope, what's going to be included in the management system? Are you going to cover everything? Are you going to look at every part of a multinational, or are you just going to look at one site? Are you going to look at one department? If you look at one department, then the rest of the organisation is either an external provider or another interested party, or perhaps both. And then it covers setting up the occupational health and safety management system, making sure it meets all the requirements of the standard, so it covers everything in the plan, do, check, act cycle. Move on to the next clause, leadership and worker participation. This is a significant part of the standard, and quite rightly so. And I think definitely where people are implementing good health and safety management systems, they are including their workers as part of that. But leadership as well is a significant part. So is your leadership committed? Because standard sets out how top management needs to demonstrate it. And they really do need to demonstrate commitment. They need to accept their responsibility to ensure sufficient resources are available. They need to align occupational health and safety with the organisation's other business objectives. They need to involve everyone in occupational health and safety decision making that affects them. And they need to promote open discussions. And they really should not have a blame culture in order to do this. So there's more areas within this standard than there are in other standards of where top management needs to demonstrate their direct involvement and engagement to the occupational health and safety management system. So they need to provide clear and consistent leadership. They need to respond to serious issues by applying appropriate rules rather than blanket measures. They need to include hidden issues such as exposure to a hazard and ill health that might not be immediately visible, so they need to ensure all those sort of things are included. Moving on to the occupational health and safety policy, still a fundamental part of this standard. Top management, again, is responsible for achieving the standard, and within the policy, any delegated roles need to be clearly communicated because they still retain the responsibility, even if they do delegate the actual day-to-day working of it. And that needs to be clear. And then the next big section of this clause is 5.4, where we're looking at consultation and participation of workers. This is set out in detail in the standard. Some are set specifically to ensure non-managerial workers, i.e. those people who don't normally take part in decision making, are specifically included. So part of the standard requires participation, some requires consultation, and to be able to demonstrate that actually top management has worked hard to try to do that. And that does help with some of the benefits, really, that I was talking about earlier on, because if you've got your workers taking part in this, then you are going to get engagement of your workers, and you're going to get increased motivation, and they're going to believe that actually top management really is interested in this. We move on to clause 6, which is quite a long clause because planning for the occupational health and safety management system is always going to be a big part of the activity that's going on. So, have the risks that affect the occupational health and safety performance been determined? And are they already managed? And is there anything else you can do to manage it further? Have you identified as well as your hazards and assess the risks and opportunities? So the opportunities need to be there as well. Have you determined the legal requirements and the other requirements that you're going to subscribe to? Have you got plans in place to deal with any occupational health and safety risks that can be dealt with through the system or through other business systems? They don't need to all be dealt with as part of the occupational health and safety management system, and this is the beauty really of the standard, that it integrates in with other standards and management systems that are going on in the organisation. So it may be that you're dealing with risks through your business continuity management system. It doesn't matter as long as you are dealing with them. It may be that you're dealing with them through your HR system. As long as they're dealt with, it's up to the organisation. Have opportunities to improve the occupational health and safety performance and the management system been identified? And are you looking at planning and how we as an organisation can implement them, how you can implement them, how your organisation can implement them? And have you established occupational health and safety objectives? Have you decided what they're going to be, when they're going to be? If you planned the resources needed to achieve them? Have you decided who's responsible? Who's responsible for meeting this objective? Are occupational health and safety objectives part of everyone's performance objectives where it's relevant to them? Have you decided how the results are going to be evaluated? And how are the actions going to be integrated into the organisation's business processes? Because it's no good having objectives that you can't achieve because you're not planning on how they're going to be integrated. Move on to the next clause, which is support. So, support covers resources. Are there sufficient resources in place to do what you've set out to do? And this goes back, again, to the leadership. The leadership need to make sure, top management needs to make sure there are sufficient resources in place. So again, here it's saying, have you got sufficient resources in place? Does the organisation understand what competence means in terms of its own business? Do they know what levels of competence they need at different levels of the organisation? And what does it mean to their business? And that goes back partly to the context as well. So if you're an organisation that's producing hazardous materials, your levels of competence are going to be different to if you're an organisation that's running an office and dealing with virtual reality and all those types of things that could be going on. Is every worker aware of the occupational health and safety management system and their place in it and their responsibilities in it, which go back a little way to the previous setting objectives, but actually, do they understand what their responsibilities are? Do they know what they should be doing on the day-to-day basis in terms of health and safety? And do they understand what the management system's for, what it means, and what their part is in it? So then the next thing is communication. Communication is an important part of this. So has the organisation determined how they're going to communicate, what they're going to communicate, who they're going to communicate to, internally and externally? And again, they need to take views of external interested parties into account. So how are they going to communicate with externally as well as their internal workers and contractors and that type of thing as well? Is there sufficient up-to-date and controlled documentation? Again, this depends on the size of the organisation, the type of activities you're carrying on, the processes and products and services, and legal requirements for the organisation that you're in as well. There's quite a lot of detailed information on documented information in this standard. It sets out how you should be creating and updating the standard, the specific requirements. You need to be able to identify your documented information and it has to have a description. And it even goes down as far as saying, for example, a title, date, author or reference number. You need to consider the format of your documented information. So what type of language is it in? Actually, what language is it in, full stop, if you're a multinational? Is it in one language or is it in multiple languages? And then are they version controlled? So what software version are you on? What graphics do you have? And then the media that you're going to use. So is it going to be paper? Is it going to be electronic? And how's that going to be set out? You then need to consider, it says, the standard says you need to review it and you need to have an approval system so it's suitable and it's adequate. So inadequacy and suitability also means not keeping documented information that you no longer need to use. So out-of-date information isn't up on your systems, so people get confused on what they should be looking at. And then there's a section on how you need to control your documented information. So is it available and suitable for use? Where and when it's needed? It's no good if it's there and people can't find it. Is it adequately protected from loss of confidentiality, improper use, or loss of integrity? So it actually sets all these out. You also need to consider distribution, access, retrieval and use. So how are you going to store it? How are you going to preserve it? How are you going to make sure that it still stays legible if you've only got paper versions of them and you get a flood? So, as I said earlier, you need version control and you need to consider how you're going to retain it and where you're going to get rid of it and when. access to it. Should that be view, or should it be view and amend? These are all actually set out in the standard, which is quite detailed for this. And the other important thing, that relevant documentation, I can't say the word, sorry about that. Relevant documentation needs to be available to workers or the workers' representatives where they exist. And so it's what's relevant. What's relevant is that information relevant to that particular worker? Is it about them, or does it control their health, or does it cover their health and safety risks? So they're the things that the organisation needs to consider and needs to set into place. So we move on to Clause 8, which is about operation. So, are controls established and implemented to eliminate or reduce risk to as low as reasonably practicable? Eliminating hazards and reducing occupational health and safety risk needs to follow the hierarchy that's set out in the standard, which is a fairly standard hierarchy. So the organisation shall establish, implement and maintain a process or processes for the elimination of hazards and reduction of occupational health and safety risk using the following hierarchy of control. So first of all, you need to eliminate the hazard. So this is nothing that we're not used to in the health and safety world. If you can't eliminate the hazard, you need to substitute it with the less hazardous materials, processes, operations or equipment. If you can't do that, then you need to use engineering controls and or reorganisation of work. If you can't do that, then you can use administrative controls, including training. And if you can't do that, the use of adequate PPE, personal protective equipment. So I think that's fairly straightforward to most people working in the health and safety world, and fits into quite a lot of legislation. There is a note to it, and this was quite controversial and took a lot of time, and decided on a note that says, in many countries, legal requirements and other requirements include the requirement that personal protective equipment, PPE, is provided at no cost to workers. Here in the UK, that's in our legislation. In some countries it isn't, and in some countries it becomes quite an issue. So that's why in the end the agreement was made. There would be a note to say, if you've got a legal requirement, you need to follow that legal requirement. If your legal requirement says you provide PPE at no cost, you provide PPE at no cost, and this standard is not going to undermine that legislation. But if you're in a country where it doesn't require that, this standard isn't going to put an overburden on those countries that can't afford to do that. So that was the agreement that we came to on that. And I think that's sort of quite sensible, really. The other areas that are obviously within operation that are significant is the management of change. That there's a control process, and you've got a suitable and resource management of change process in place. And that specifically says it needs to cover temporary and permanent changes. So you consider everything that you're doing, whether it's just a small change that might be happening. Similarly, we do normally anyway, but it actually specifically talks about that. Have you got suitable contractual requirements in place for outsourcing and contractors, and the procurement controls in place to evaluate risk prior to purchase? I'm not going to cover that a lot because I still don't know if that will change in this standard, because it's one of the areas that I know France in particular has some issues about outsourcing. And then there's also the question of, are they the right way around in the standard? Should procurement come first, and then is outsourcing and contract as part of procurement? So there's still quite a discussion to have on that. So I'm not going to go into details of things that I think might actually change as we go forward. So the other thing that we were looking at on that slide was emergency preparedness. So have foreseeable emergency situations been identified, and do you have plans in place? And again, depends on the complexity of your organisation. If you're a large coma site, you'll have detailed plans in place or safety cases. If you're a small office, it will be talking about first aid and your fire drills and that sort of thing as well. Then we move on to clause 9, which is performance evaluation. And this is quite straightforward, really. So have you looked at what monitoring and measuring requirements you need? Have you identified what they are? Are they appropriate to your context and scope, in proportion to what you're doing? Do you have an internal audit programme? Do you have internal auditors? Are they competent and are they independent? Which are the quite important parts of it, because if your internal auditor isn't competent, they're not actually going to help you with setting your system up. Is there a management review process in place? Do you look at what there is and what's happening, and following the plan, do, check, act? So you've got the check, and you need the process in place before, so you can say, well, actually, we're going to act on that. Right, some additional requirements to ISO 9001 is the investigation of incidents, because obviously they don't exist in 9001 incidents. You just look at non-conformities. When going through this clause, actually it's all set out separately to start off with. So it's talking about non-conformities and incidents, and then as we'd gone through and looked at what do you do if you're investigating a non-conformity, what do you do if you're investigating an incident, it actually came up with all the same actions. So that's why they're all sat together in there. So do you have a process? Do you have a process to investigate incidents and non-conformities? And is that process proportional to the incident? You don't want to go all out, spending weeks and weeks investigating an incident that isn't really going to get you anywhere, because what you're doing with your investigation is trying to identify your immediate and your root causes of that incident. And does your process identify corrective actions? You may note that within this standard there's no talk of preventative actions anymore, and that's because the whole standard is a preventative document, so it talks about corrective actions. And can continual improvement in the management system be demonstrated? That's quite an important thing to look at, and it's continual, it's not continuous. So it's incremental improvements that you're looking for, not the standard isn't looking for a continuous improvement, it's looking for improvements that go on through time. So a few notes on what the differences are to OSS 18001. So why is it different? It's different because it started from a different point. It started from the Annex SL text. It didn't start from OSS 18001. So I think I've answered one of the questions that have come in now. Why we didn't start with 18001? It's because it's Annex SL text that sets it out. Although 18001 was in the back of a lot of people's minds, weren't fiddling in some of the detail in it. So the main difference is context. There's more relevance in how it can affect the way an organisation manages its occupational health and safety risks, both positively and negatively. And that's what I was covering earlier on at the beginning. It's up to the organisation to decide what its context is, and that will affect everything else that goes on. Workers and interested parties. Again, this is a big part of 18001. So the needs and expectation of workers and interested parties with a strong focus on workers. So there's much more detail about considering the needs and expectations, then deciding whether these need to be addressed within the system. There's an increased focus in the involvement of workers, as I've said, and I don't see that as a bad thing, and I don't think anybody listening in today will see that as a bad thing, because if you get your workers involved, your systems will work well. Leadership and culture. So the requirements, as we covered, specific to the top management with regard to demonstrating leadership commitment and promoting a positive culture that supports the intended outcomes of the occupational health and safety management system. That's some of the significant differences really in this. Participation and consultation, as I've gone through and discussed quite a bit really, that worker involvement sits quite differently in ISO 45001. Risks and opportunities to the occupational health and management system, occupational health and safety risks, occupational health and safety opportunities. So all those are slightly different really to 18,001. Documented information is slightly different terminology and use than it sits in 18,001 because it replaces documents and records. It talks about any documented information. So operational plan and control, there's more detail. It talks about shared workplaces. It talks about hierarchy of control. It talks about management of change. Outsourcing and procurement, you'll see is in a different colour because, as I've said, I'm not sure what the outcome of that will be. It will definitely sit in there, but it may just all be swapped around, or it may be different when it comes out of this term. So it'll be watch this space. When I know what it is and I can disclose it, I'll put something on the alumni site. And contractors is in more details as well. Evaluation of compliance, again, there's more detail on that. What's the organisation's status on compliance? The organisation needs to know where it is. It needs to know what it knows. It needs to know that knowledge is maintained, and it needs to understand what it does know at any particular time. So that's quite new as well. Management review, it's not a lot different. There's more detail. There's more coverage of inputs and outputs. Incidents, non-conformities and corrective action, there's a more detailed process requirements, and as I've said, preventative action is now being replaced by the risk approach, which is something that we all understand in the health and safety world. So what's next? Right, my advice is keep up to date with the outcomes from the September meeting, where big decisions will be made. And as I've said, as soon as I can post something, I will post something, and it's out there, so you should know and get some decisions in October. As an organisation, you need to decide, do you solely want to implement a standard or part of a standard? Do you want to build up to it? Do you want to use it as stepping stones? Or do you want to get certification? They're slightly different. And the standard isn't designed for certification. Standard is designed for implementation. I advise you get a copy of ISO 45001 when it's out. If you want to get started now, and I don't think there'll be that many changes, get a copy of the DIS too, and I've got some links later on, or the final DIS when that's out, if it goes to final DIS. The other thing that will be coming out is BS, British Standards Institute, are going to produce a BS 45002, which is a document guidance for implementation. So if you're only implementing, you might just want to look at the British Standard. If you're certifying, you'll definitely need to look at the ISO 45001. So it's kind of you choose really what you want to do. And the anticipation is, or the hope is, or the plans are, that BS 45002, which is guidance on implementation, will be available around the same time as 45001 is published. Carry out a gap analysis of the organisation's current occupational health and safety management system versus 45001. Or if you have currently you have 18,001, do a gap analysis of what the differences are, and there is a document I'm going to do a link to that actually sets that out for you quite nicely by NQA. So develop your implementation plan, and then obviously update your existing occupational health and safety management system to meet the new requirements, and then provide verification of effectiveness. And if you're currently using 18,001, it'll be looking at how you transition from 18,001 to 45,001. If indeed that's what you decide to do, because I don't know when or if 18,001 will be withdrawn, and if it's not withdrawn, will it then be updated? I don't know. OSAS group will make a decision on that, but as I said, some countries have 18,001 implemented in their legislation, and some countries will have 45,001 implemented in their legislation as well. So that's why a lot of the arguments about what's in it take so long to decide. Well, not arguments, but discussions, because it can have such an effect on some countries that currently don't have those requirements. So I've put a few useful links in that I think are really useful. So there's a BSI document, Understanding the New International Standard for Occupational Health and Safety. That's a very useful guide. DIS 2, I've looked, I can't see anywhere where it's available free, unless you've got a subscription service such as Barber or Technical Indexes or a trade organisation. But you can purchase it from the BSI shop on this link. I think it's £30. The other useful links is the BSI key facts documents. That's really useful and covers a lot of information. And if you are currently on 18,001 to 45,001, this NQA gap guide does all your work for you. It's actually got quite a detailed list of what clauses are needed for 45,001 and what does it mean. That's the end of my presentation. So I think Matthew might have a few questions for me.
Yes, we received a few, Teresa. You'll be pleased to know there's nothing very, very technical about the specification, and the more sort of general questions around the standard. So fundamentally, why are we not just updating 18,001?
Well, it's because 18,001 is a completely, in some ways, it's a completely different animal to 45,001. OSAS group is not connected to ISO. So OSAS is a small group, international group, of people who were interested at that time in developing a standard, whereas ISO covers all the countries that take part. As I say, there's about 46 countries taking part. So the number of people in an ISO group, countries taking part, are a lot wider, and there's a lot more implications for it. So OSAS 18,001 was due to be renewed, updated, but the decision was taken, actually, we'll see what 45,001 covers, and hopefully that will replace it, because the OSAS group, as I say, was a group of interested people from countries around the world, but not every country that was interested in developing it.
Thank you for that. What were the drivers then for the introduction of 45,001?
All the ones we've said, really. So there's been a lot of discussions for a lot of years to develop an international ISO standard that fits in with the other standards that ISO produce, management systems. So I think there's been a lot of discussions behind the screen that seem to get it done, and there's been a lot of requests from countries to develop an ISO standard so that it gets certification to an ISO standard and one that fits in to their list of things they're doing. But the main driver really is to get an ISO standard out there on health and safety management that will improve health and safety in the world for areas that won't take up OSAS 18,001.
Okay. Somebody's asked, ISO standards don't normally take 4 years plus to develop. Why has this process taken quite so long?
It shouldn't have taken this long. It should have been finished in September 16, and that was the original timescales that were set out. But as you've seen from the earlier slide I set out, there are a number of areas where we couldn't get consensus. So we couldn't get the first committee draft agreed straight away. So that added another 6 months on. We couldn't get approval for our first draft international standard, so that added another 6 months on. And because there's a lot of interest in this standard, I suspect there's more countries taking part in developing this standard than in any other standard. I mean, there was a lot involved in 14,001, but 18,001, health and safety is so fundamental to people's health and safety as it sets out. The countries have a real interest in it.
Yeah, no, thank you for that. So one participant has observed there haven't been many changes from DIS 1 to DIS 2. Why is that?
Because a lot of the discussions to get to DIS 1 had already been discussed a lot of times as well, and because you need consensus. So we'd got to a stage of DIS 1 where the working group had agreed, actually this is good, this is right, it's what we can do. And then what happens is the comments come in and we look at them, but quite often the comments that come in are actually ones that have already been discussed and covered at great length. So decisions then made, well, actually we've already gone through this, we've already looked at the rationale of why it's included, so it's not going to be changed.
Okay, great. So somebody's asked, what can they do if they wish to take part in developing ISO standards in the future?
Well, if you're in the UK, look on the BSI website, and I'll put that link up as well. So there's a section in there on what do I want to do if I want to take part in developing standards or take part in BSI development of standards, and there's various groups. The health and safety management group I sit on is HS1, so they are always open to new people who want to come on and look at standards. So it's any health and safety management system, and anything that's related to it we'll be looking at. Actually taking part in the next iteration, the 45,001 could also be an opportunity if you're there on as part of that committee. So I'll put that link up. In any other countries, there will also be mirror groups. There will be standard setting organisations that also take part as well. So look for those and take part. The other thing you could do is it goes out for consultation. There's always a consultation period for any document that's going out. So look out for those and take part in the consultation and give some feedback as well.
Okay, so you mentioned consultation, the importance of consultation when I think it was under the leadership section. What sort of things would ISO expect you to consult workers on?
In fact, if you're looking at the standard, there's quite a lot of things that they're requiring consultation or participation on, and they're going to quite depth that wouldn't necessarily, as far as actually just developing the occupational health and safety management system itself, and looking at training, who's going to be delivering the training, and looking at the competence of people you're getting in to deliver training. They're all things that you need to be consulting with.
Well, this question's connected, but we outsource some of our activities to another organisation. What sort of checks would we need to do? What checks would we need to do on the contractor?
For outsourcing, it really depends on whether what you're outsourcing actually affects your occupational health and safety management system. So is it genuinely outsourcing a process as part of your system, in which case you're going to have to be very involved in it? Or is it actually a supplier and you have no control over what they're doing and what they're purchasing? Is it an off-the-shelf item you're buying, or is it actually your process you're outsourcing that you normally do in-house? And then that does have to have an effect on your health and safety management system. So you'd expect to put into your contract all the normal health and safety requirements that you would have, and probably be auditing them. Okay.
There's probably a question here that might be a little bit difficult to answer, but I'll ask it anyway.
Thanks.
My company is going for recertification of 18,001 next month. Should I go for 18,000 or wait for 45,001?
I would go for 18,001 and then look at the transitions going on, because otherwise, the publication may be out at the end of October. Will organisations be ready to certify you by then? Will you have done the transitions by then? And what if it doesn't happen, if it then gets delayed and you're out of certification? My advice, for what it's worth, would be go for your recertification and then look at transition arrangements and give yourself a bit of space.
Brilliant. Well, this is a much more easier question to answer. Will we be putting a copy of the slides on the alumni website?
Yes. The webinar will be up there, and my technical colleagues in the team will be sorting that out. Okay.
Alison's asked, why have ISO gone for participation rather than engagement?
Because participation and consultation is the normal technique. Because actually, I've changed my mind on that answer.
You're allowed.
Because actually, it was a discussion on what do we mean by participation and consultation, and what do we want to do. Engagement probably isn't strong enough for some of the people that were taking part in that work, because you have a lot of bodies like the International Labour Organization, who quite rightly are there, and part of their role is to make sure that we're considering workers and we're including them in there. And in the UK, we're very keen on participation and consultation. So what the standard does is look at, actually, where do you need to participate? Where do you need workers to be consulted on? And all of those really are engagement. It didn't want to be, or the participants in the standard didn't want it to be woolly. Wanted it to be clear. Actually, when have you got to allow and encourage your workers to take part and be involved in this? And when have you got to consult with them and talk to them and listen to their comments? Whereas I think they wouldn't have thought that engagement was strong enough.
Right. Okay. I'm mindful of time, so we'll make this the last question. Somebody's asked, will 45,002 be released at the same time as the standard?
Hopefully. The plans are, and we're working to issue that at the moment. It's actually out for public comment. So if you're interested in 45,002, it's out for public comment till, I believe, 8th, 9th or 10th, I don't know the exact date of October. So if you go onto the BSI website, you should be able to get through to that consultation.
That's it.
Right, thank you very much.